I've spent 21 years in the United States, so good afternoon. I spent 21 years before that in India, so namaskar. And I flew last night from Chicago for 18 hours to spend 18 minutes with you. Salam alaikum. With that, let's get started. The topic that I've chosen to walk through is the journey, as we call it. It is known that the journey is as important as the destination. And in this case, we do not even know the destination fully clear yet. So it makes the journey even more relevant and important to discuss. The greatest ideas and the greatest implementation of those ideas, a lot of which have been discussed all through the day, profound ideas, I think bring to bear when they hit at you right at home. I'll tell you what I mean. A few months ago when I was at work, I got a call from my wife about my son. He's a 12-year-old active boy in sports, and she called me and said, there's been an accident, you need to come right away. The first reaction any parent would have, and there's quite a bit of parents I'm sure in this room, is your reaction would be, how bad is it? That curiosity is your first thing. And he was hit by a dodgeball in school. They patched him up quickly in the nursing at school, and we took him to the emergency. A lot of what we talk here, really as a parent who looks at your kid going through that process with a broken nose, the patient entry into the hospital, getting your insurance cards given, the data checkup, waiting for treatment, and when my son was asked, like it's a typical protocol, on a scale of 1 to 10, how bad is it? All boys try to be brave, and he said, 0, I don't feel any pain. Now the problem with that is he gets pushed back in the waiting list, prioritized with other emergency patients. It all ended up well. He was back, fixed, up and running. But in the end, it gave me a good insight into the whole cycle. There were a couple of things that worked in our favor. The same hospital we went to in emergency was where he was born. Lot of data. This is a wonderful hospital, St. Alexius in Chicago. Very empathetic nurses, receptionists, doctors, the whole staff. But what they were equipped with and why it is very relevant in today's world, they had the data accessible for a timely action. So what could have been a lot of stitches on his nose ended up being a quick patch-up with a minor scar. And his bragging rights right now to end that story is, he says, this scar is a better tattoo with a story. So with that, let's dive in. Before we leap into the future, I think what I want to emphasize is, let's look at history and how we have come through a brief history of time before we talk about the future. The fundamental thing in terms of our evolution of life into Homo sapiens that we are today, right in the middle, perfectly balanced between the Homo deus of the future and the hominidae of the past, is curiosity is what enabled our cognition and the cognitive revolution about 70,000 years ago. But the real progress has been made just in the past few hundred years, and where we are headed into is much more dramatic. And that journey is pretty exciting, and a lot of interesting ideas were discussed on it. But I think let's look at what Homo sapiens are. What is our expectation in context to healthcare, and where is AI helping in that journey? We have spoken quite a bit about ideas, executions, the what and the how, but I think if we boil down the entire expectation of a health seeker is primarily key things. Applies to my son's case, applies to any patient walking in or calling in for help. Realize my situation, empathize with me, personalize and individualize with me, don't make me a benchmark, and address my situation. That, I think, is the foundational expectation of a health seeker. So the solutions we are talking about, the ideas we are exchanging here to implement, as long as they're focused on that health seeker, we would have good outcomes. The landscape is globally the same. What we saw in the earlier slide is about the same. That same health seeker worldwide, regardless of nationality, religion, or geography, anywhere, the myriad systems, processes, and devices we have boils down to one key thing, which is take care of my situation. I think it boils down to also one theme I want you to carry with you in terms of the data that's exchanged today is a successful AI delivery in the healthcare landscape boils down to just one word, which is timely action. Artificial intelligence can also be said success is actionable intelligence. In the landscape of things, where we are right now is descriptive. When we walk in, when we bring someone who's sick, accidental or prolonged, we typically get what happened. I think what would enable us to get better and better over time is explaining why did it happen, what could be done to prevent it, and I think the ultimate goal is prescriptive, which is what should I do today, tomorrow, and day after to maintain a healthy lifestyle. As long as AIs and the solutions across multiple domains talk through all day, they enable timely actions, we would have very, very successful outcomes. Let's break this down into a few dimensions. As a software engineer and as an investor and an entrepreneur focused on healthcare, education, and AI, this is a perfect opportunity to put through frameworks in how we think about these solutions. We look at opportunities, we look at considerations, we look at what is the way to implement it to get to the goal, and finally we'll talk about an AI in real action, one of the products that we had incubated last year and seen some success. I wanted to share some of that. Talk about opportunities. AI follows exactly the same framework. What are the real possibilities and how much is hype, how much is real? Let's make sure that we balance and consider innovation with an equal look at regulation. And when we talk about implementation, let's make sure that we are balancing feasibility and accountability. Let's look at opportunities. I think humans have always gone extremes when new technologies have come up. When cars and automobiles were being created, people driving horse carriages said it was a fashion that will run away and continue to manufacture horse whips. The minute automobiles came into the marketplace, the hype was by 2000 we'll have flying cars. Now, I haven't seen any flying car yet, and I don't think that's happening anytime soon. We are now getting into driverless cars. The same will apply to AI. In terms of opportunities, we need to make sure we are focused on the basics. What we call today as patient wards are streaming with data, and you can capture that information for timely action. What we call waiting areas, I think everyone in this room is familiar with it. I was forced to be familiar with it with my son's situation, and those 12 minutes felt like 12 years. That is significantly efficient. 12-minute wait time is not ordinary. If you give someone 2 hours of wait time, you can just imagine what is going through the patient's mind, the parent's mind, and the children's mind. We need to continue discussing how to convert these waiting areas into health experience areas, and that is something that with the IoTs, with the AI technologies, is something we can actually enable. Much has been talked about the healthcare landscape, but I think it boils down to a few things to focus on. So many ideas have been discussed on what can be implemented. The real focus boils down to the one that we just had a good discussion about is the medical image analysis. That would have the most profound effect. Not surprisingly, the most investments are happening in there. There have been very interesting questions earlier in the day on, is this gold rush going to push everyone into getting in there to make money versus how passionate are the engineers, the scientists, the healthcare professionals, the providers, the insurance companies, how many of them are looking at one step beyond just the gold rush. Other components such as the basics, which is converting paperwork into digital data, the low-hanging fruit. I'll continue to take that simple example of my son because having that quick access to his blood type, the nature of his issue, all the data from birth, that was the simplest digitization that helped me get immediate resolution. So it boils down to these things. I think they have been covered at length today, but if you take away at least one idea and bring it to action, if you're looking at it from a perspective of a startup company, and we have looked at several companies looking at it. The one common theme, having invested and exited a few companies, that I, as a founder, consciously advise entrepreneurs and others looking into this AI space is to see, is this problem worth solving, and does it have a big impact? If there's any notes that can be made, I know there's some students in the room as well, these could be some things you could take away and say, let me take one problem and solve it exceptionally well than trying to solve the entire landscape and boil the ocean. Let's look at considerations. I think given the opportunity of AI landscape is very big, the considerations come into bear to make sure that we are aware of AI winters. The hype has existed before and died down. This is a ripe market from the 50s to the 80s to now, is because of information at a computational power that is available to process. A lot of metrics were shared earlier. Now we are at a point where the computational powers exist. The data exists. It's a perfect meeting ground to make this real. Innovation versus regulation. This, I think, is going to be the cornerstone of where AI will actually succeed or hit another winter. Unlikely, but if proper focus is not put on these areas, between making sure that you don't treat a person and his data as a benchmark just to compare. Earlier in the day, we were talking about 95% accuracy and 96% accuracy. The real focus will be on the 4%. That is what will drive where this is headed. Before you integrate many systems, make sure that you localize and make sure that you're watchful for the regulation. As we are training people, I know some of us have spent more than a few years reading and constantly researching the AI space. Some of you have walked in to understand. When we train people and educate people in this area, we want to make sure that all of us, including the speakers here, is to simplify the data. If we take them to an abstract level, it's going to be very complex for them to absorb. And as humans, Homo sapiens, before we evolve to the next species, if we don't understand something, we do not trust that something. So the key for educators in the space is to make sure that you build that bridge of knowledge so that people can understand it and trust it. And primarily, as we move into the next phase, which is implementation, which is the heart of execution. Having been in the middle of these implementations, I'm going to share you what we have observed. Not all the information is comprehensive, but at least it gives you a framework. I think if we really look at the B2B landscape and the B2C landscape, the business to business and business to consumer, some of the speakers have covered this at extreme good length. But I think one takeaway from this is to make sure that hit the very basics. On the consumer side, the devices that we put on our wrist right now that alert us to stand up, that take a moment, even basics like that, things that alert us to take our medicines, things that help us schedule these appointments on a recurring basis, because humans by definition forget. Those are the consumer side, and patients record management. The startups that are coming in that space are going to solve that problem. The opportunity exists there. In terms of B2B, I'll speak for the United States regulation and Obamacare and others. They are keeping a strong focus on patients who are being readmitted within 30 days and saying that as a provider, solve that problem. Otherwise, we'll make sure that you are not compensated fully should that occur. That is a strong regulation. So it is essential that as we look at discharging a patient from the hospital, what data elements are we capturing to make sure that they're not readmitted into the hospital. There's a wide range of networking between NGOs and providing hospitals and governments KPIs. A lot of discussion already happened on it. That can have a very dramatic effect on the B2B. For those looking in that area, there is a wide opportunity. And I think the organizers of the event, Tumbe Technologies, and the team who have done a wonderful job setting these discussion forums should encourage more business-to-business discussions on what can we do as a collective group, collective team of researchers, businessmen, investors, engineers, healthcare professionals. These are the platforms that are required in AI. Many, many such events have to occur. And as educators, we are happy to fly any distance, any length to encourage these discussions that prompt the right questions and dialogue and debate without going overly positive on AI or overly negative on AI, but stay realistic. This is more a technology slide. Are there any software engineers who program in this room? Thank God I have company. Great. I think talking about how to implement needs a framework. A framework starts with the foundation of balancing between technology on one end, the industry on the other, and the market forces that drive it. These are basic frameworks that we use to evaluate a company when it is doing AI-based technology work. At the heart of it, AI is almost misused in some areas. Just writing an algorithm that does point A to B is not AI. It needs a staggering amount of data to calculate and learn itself, as we have seen in several presentations, to be called an AI product. So one responsibility that we have in the industry is to make sure we educate these startups on what is really AI and not be caught up in the hype, but those where we see a ripe opportunity, we strongly engage with them and show them the guide to the next step. The interesting thing about this field is the teacher is also the student, so we're actually teaching as we are learning ourselves, and the whole concept of robots are learning themselves. So everyone is learning, and there's no better way to call this practice, which doctors use even today for all their professional work. Outcomes of a well-executed AI, it is fairly straightforward. We boil down to the basics. It enhances the health seeker experience. It makes sure that it is driving preventive and precise health outcomes, not generalization, that very specific outcomes. I think not enough thanks or gratitude is given to the health provider, be it the nurse, the receptionist, the doctor. All of these have only a limited amount of energy and time. I think these technologies are going to be sensitive, and the best gratitude you can give to them is empathize with the health provider as much as the health seeker. And I think where we began was enabling a timely action. That is what we call a well-done solution, and AI would be a perfect fit for that. Let me take a quick example of what we have done without spending too much time, because it makes sense to call a case study to really see in action. One of the products that we have incorporated and incubated closely is called Seventh Sense AI, and the tagline is probably the essence of our solution. We are giving newer dimensions to give better decisions. AI is primarily of two types: horizontal AI that's going to solve wide-scale problems, wide scale, and vertical is solving a specific problem. What we have embarked on is taking something that can be applied cross-domain, and we have seen delivered AI results, as in a transportation company, we were able to connect the driver to the passenger. In an education company, we were able to connect a professor to a student. In a healthcare, we are able to connect the provider to the health seeker. And we are now working in the finance domain using APIs already out there, TensorFlow and others from Google, without having to create them from scratch. I think the second part of a successful AI product or solution is making sure that you simplify the data transformation and delivery mechanism and provide the end-to-end with proper documentation and proper connecting dots. And a very strong focus, obviously, which we talked about, is on regulation and the controls that need to be watched out for. In the healthcare space, the key targets that we have taken are the simpler ones first before we engage into complex ones: the medical records automation, bringing in data of a few hospitals and seeing that are we able to generate the right amount of analytics and results that will help the hospital save costs and lower cycle time and improve the health seeker experience. These are some of the investment opportunities that Colosseum Group that I have founded has been actively on. I wanted you to focus on the first three. They are focused on healthcare, AI, and Medic on Demand, one of the products that connects the provider and the health seeker. The others are more education focused. Bottom line, as we close this speak, before we embark onto the homo deus, where we are not going to manufacture a greater automobile, a more fancier version of our microwaves, what we are really embarking on the healthcare journey with the AI-assisted technologies is really manufacturing a more enhanced body, a more enhanced mind. Those would be the new products in the next century. I think there would not be an extinction of Homo sapiens evolving to Homo deus. It would really be what ideally one of our speakers put, it's man and machine. I don't think AI is going to replace doctors. Doctors are going to replace doctors who do not use AI. That's the way to look at it. Being an engineer and a geek before anything else, it would be an injustice to close a talk without something that relates to futuristic Star Trek. I think that reality exists to your left, which is aging. It is the same actor, and what we have in our minds is a fascinating eternal youth, which is our goal. I think this is what the future will be focused on. We will move on from, in a century, to curing diseases and solving problems, to really going to that ultimate. And there are already companies that are being incubated to solve the technical problem called death. I had to close out this with that story. So here's that nose cut that he began with. And before I got on my plane, they were posing and wishing me good luck and hope I don't trip on stage. So that's my two boys. And that was the situation. It wasn't serious. And this is the message I want all of you to carry. AI, when well done, is something I wish for my family, your family, and everyone at Dubai. Shukran, and live long and prosper. Thank you.